So the question is, looking back a year, what has it been? I think, first of all, I think you could imagine that we've had to change and pivot and really focus on this. This has been a very consuming portion of our job. I think that from everything from environmental health and the enforcement procedures that had to go on regarding the executive orders, but more importantly, all the things and structures that people had to adapt. I mean, think about all of our restaurants going to carry out and things like that that had to occur. We continued to do those inspections. All of the school lunches that had to continue to be provided to families, and we had to make sure that that was changed up so they could be safely delivered. So our environmental health teams as well. And of course, many other public health concerns don't take a break. So other communicable diseases that we continue to follow throughout that. I also say that it's hard when you report the numbers and you learn of the deaths and you learn of the family members and you recognize those are lives lost from our community. And I think at the heart of it, when you're a healthcare provider, a healthcare, a public health person, your goal is to prevent those deaths. And what a hard one this has been, because the tools we had, when you think at the beginning of this, social distancing. We didn't even have face coverings to start. We didn't even talk about face coverings. We hand wash, stay home when you're sick, and progressively adding more as we learned more about this disease. I think the biggest challenge is when you come out every day and have to talk about it, is that we're constantly learning more about this. And we talk about the recovery rate, but I can't tell which one of us, if we were to recover from it, would be considered a long hauler. Which one of us, maybe in 10 or 15 years, may have a complication that they may later attribute to COVID-19, or which one of us might have been hospitalized and require a ventilator. Which one of us might need a transplant associated with that following. So those become some of those kinds of, what I would say, that unpredictable novel. And as we progress through then learning more about vaccines, right? And wouldn't it be great if we had one vaccine and everyone got the same and it only required one dose and it was magically effective immediately with no side effects? Wouldn't that be? That's not what we got. We're learning more about these vaccines. We have 3 different types. They come out at different times. They all have challenges logistically. So I say it's a constant learning curve. But at the end of the day, as we've said before, and I think was summarized for another media outlet, was every day this team has come in to do the very best it could with the information it had, with the sole purpose of protecting and preventing the transmission of this illness and protecting the health of this community. As we learned more and had to change it up, we did what we needed to do. I'm looking forward to a time when we can start talking about some of those other public health considerations. I mean, we were very much involved with prevention of overdose and opioid. We were addressing the opioid crisis, and how do we do that? We know that we're probably going to have to really kind of recover and come back afterwards, because we know mental health has suffered significantly during this pandemic. Things like maternal and mortality. We were working on maternal mortality initiatives, and how do we improve maternal and infant health outcomes in this community, the trauma-informed work that we were doing. Each public health challenge has its own, but every day we came in to do our best, recognizing this was the immediate, that we needed to protect the life and health of our entire community.